Kinesiology at the University of Nevada. He's been doing that since when? 2009 or so.
Gotta get mic'd up.
He is an extraordinary physical therapist, probably one of the very best in Reno, if not the entire West Coast. But he's here to share his thoughts on the importance of shoulder mobility.
So I think about shoulders a lot. Everybody has a profession. I'm a physical therapist, so I think about shoulders a lot, kind of all day, every day. I've probably seen about 2,000 shoulders now. So I'm watching all of your shoulders as you move. I'm watching shoulders out there, shoulders every which way. I'm always thinking, why do people have shoulder pain? Why do they come in here with their shoulder pain? And the more patients that I see, I've kind of come to some conclusions a little bit. And I'm always trying to figure out how I can be better. I'm always going to conferences, talking to great professionals that we have today, talking to my business partner, Dr. Anderson. How can we be better at our shoulders? So at the end of this, I'm just going to show you just a new little shoulder stretch that I've been working on that seems to be helpful. And how do we get this to play? See if we can get this play. So I was watching this guy on the playground. See if it plays for us. And he's 5. And he's cruising these bars pretty easily. I'm like, wow, he doesn't have any shoulder pain. But how strong is a 5-year-old? Like, is a 5-year-old that strong? Like, he's pretty strong. That guy's pretty strong. I know him. But I'm like, wow, you know, does he need a lot of strength to do that? You know, maybe. This is the shoulder joint. Some of you guys may know that. Some of you guys may not. This is the scapula here. And this is the paw where the ball and socket of the shoulder is. And there's a space in here between the acromial arch and the humeral head where a lot of stuff passes, including one of the rotator cuff muscles. Joel knows about the rotator cuff all too well. He had that torn, but he had it repaired. And there's not a lot of space in there. And if that space, which is about 1 centimeter, gets reduced, you kind of end up in the clinic here, or you end up having surgery, or you end up having pain. So if we can get that space wider, that's a good thing to have happen. There's a spot in the shoulder called an axillary pouch down here. It's like this little extra tissue of fold that's underneath. Kind of like my shirt here, there's a little extra tissue there. And if you have enough tissue there, the shoulder seems to behave pretty well. If this tissue gets a little bit tighter, we have all kinds of problems in the shoulder. It tends to kind of cram that acromial arch up there. So the more we can kind of stretch this area out is better. I see some high-level athletes. This guy here, he's a CrossFit athlete. Some of you guys may know him. He's built like a truck. I mean, he's got muscles on top of muscles on top of muscles, and he's just solid every which way. But he has a fair amount of shoulder pain. He comes, sees me on a fairly regular basis with shoulder pain. And I have him, move his shoulder. He's kind of like, what do you think? Pretty good? And I'm like, no. So I'm always working with him to work on his range of motion to get like that 5-year-old kid to get more range of motion, particularly this axillary pouch right there. So we have patients do certain exercises, and I was looking at that overall mobility. Is Amanda here? There you go. So most people, when they raise their arm, get in the camera section here, we're looking at, that's pretty good range of motion, but most shoulders should be able to go farther without too much pain. Does that hurt at all?
No.
I talked earlier, she's never had any shoulder pain in her life, and should be able to go kind of past your head a little bit. Let's see this side. And up until a few years ago, I didn't really have people go much farther than that. Good, thank you. So I've just been adding a little more stretching to the routine. So last slide I got, we get to eat real quick. 1 minute, great. But if you look, and patients that come in, they're not always that happy. But Sarah's a pretty happy person. So, but I have them kind of cross their arms up there, working on that stretch right there. And if I take my patients a little bit past where they're comfortable a little bit, and if they can go that far, their pain kind of eventually goes away. So one of my tests of shoulder mobility is, can you get your arm past there? Are you a nice, supple type person, or are you kind of, concrete man over here that can't really move too well, but super strong? So it's just something to add. For those of you that work out, you may stretch yourself overhead. Maybe try a little bit extra to go farther, and you might get even better results. So just a little food for thought as we go to eat food. Look at that little play on words. So we're going to exit out that way, correct, Dr. Anderson? We're going to exit. We got a food lineup. So we got a little food right now. So eat quickly. We got about 10 minutes for food, and then we got 4 more great speakers after we eat. So hopefully you come back after that. Here you go.
Exit out this